Good morning, everyone. It is Tuesday, January 4th. Welcome to the Morning Medical Update today. Thank you for joining us on Facebook and on YouTube. As students start to come back after the holiday break, some school districts around the metro are talking about bringing back face masks or making some sort of changes to COVID protocols. And this is, of course, all thanks to a surge in Omicron cases that we are seeing. Before the winter break, some districts were seeing the highest number of COVID cases since the pandemic started. So this has parents, as you can imagine, worried, students concerned. We have two education experts with us today to talk about all of that. We're going to dive deep into schools and what we are seeing. So make sure to get your questions send those in via YouTube, Facebook, and email them right there to the Medical News Network. You can find links right there on your screen. We're going to get to COVID numbers in just a moment, but I want to bring in Dr. Stites here with a message about what we're doing tomorrow. I'll let you have the floor.
Yeah, you know, it's a big deal. Can we hit the COVID numbers really quickly? Because they're going to help
you want,
set up the
let's go back over.
Hawkeye. Is that all right? You got them?
Yeah, right now in the hospital, Steve, they've gone up from, of course, a couple weeks ago, but even yesterday, 80 active infections, 19 in the ICU, and 15 of those on the ventilator, a large proportion on the ventilator, and that's always a bad thing. 40 additional patients meeting that recovered criteria, but a total of 120 patients in the hospital.
That's our highest in a very long time.
Of those 80 infections, 6 are fully vaccinated. And of the ICU patients, 1 is fully vaccinated out of those 19. And do you know how many of those 15 on the ventilator are vaccinated? A big 0. So again, vaccination does help.
So let's hit this again. We're up to 120 patients.
Yep.
80 are acute.
Yes.
How many are in the ICU?
19.
And 15 are ventilated.
Yeah, almost 25%.
All right, so let's look at a couple of graphs for just a minute. Can we show the graphs, guys? So I have to run a clinic, but I wanted to come and talk a little bit about this. This is the daily new cases throughout the country. Look at this number. Look at this, the way to the right. Look how steep it is relative to any other period of the entire pandemic. Now go to the next slide. It's true everywhere you go. If you go all the way back and see what's in here, these are new admissions for patients with confirmed COVID-19. We're back to the highest point of the pandemic. For those of you who say, it's just, oh my cold, think again, oh my gosh, what does this mean? 15 out of 19 patients on our ICU are on a ventilator. Don't know if that's Omicron or Delta. Not even sure right now how much of the outbreak in the Midwest is Omicron and Delta. Last week we estimated 50-50, maybe the same this week. Point is that we have an outbreak, we have a twin-demic. We still have a lot of Delta, we do have a lot of Omicron, and together we have a lot of patients. Tomorrow we have a really important conference here. We have a really important media update because we're going to have chief medical officers for the very first time from not only the Metroplex, but across the entire state of Kansas, all the way to the Colorado border, all the way to the Nebraska border, all the way to the Oklahoma border, across the state of Kansas, because this problem, probably for the first time in the pandemic, is hitting all of Kansas at the same time. This is a dangerous moment. We're not trying to scare you. We're just trying to be honest with you. Maybe we are trying to scare you a little bit. Maybe we are trying to get you to say, you know what, those rules of infection control I sort of let go of. Maybe we better take it a little more seriously. You want to keep schools open? How are you going to do that if everybody's sick? If all your staff are out, all your kids are sick, how are you going to do that? How are you going to keep businesses open? If we don't take the rules of infection control seriously, this curve will bend us. It's already bending your hospitals right now. You're going to hear about that more tomorrow when we talk about the impact on elective surgery and clinic visits and our ability to take care of patients. We are at a critical juncture. And today I have a combination of fear, I may be a touch angry, and a whole lot of frustration. Normally we try and paint a really optimistic view. We're going to be really honest tomorrow, folks. Gloves off, real conversation. If you don't want to listen, fine, but it's going to get you. Omicron and COVID is everywhere, and if you refuse to take precautions, it will find its way to you now more than any point in the pandemic, because Omicron is very transmissible. The second major point to consider for those of you that think it really is just another cold, if hospitalizations are reduced by 40 to 70%, that's great, except if 3 to 4 times as many people have COVID all at once, the total number of people in a hospital still goes up. You can point to the South African data, and there's really a lot of hope there. But remember, the South African population is much younger. Remember, we have a large population in nursing homes. We have a lot of vulnerable people with chronic diseases because we keep people alive a lot longer in this country. That person may be you. You should be very cognizant of what's going on around Omicron, what's going on around Delta, in this, our true twindemic, Hawkeye, of this entire pandemic.
Yeah, I venture to guess, and this is just speculation, but that large new admissions graph that you had showed initially, I would say that I would guess that 90% or more of those admissions are unvaccinated people.
I bet you're right, and I bet a lot of it's still Delta.
Yep.
And those outcomes in Delta are tough, and you see that on the number of people in the ICU. Mm-hmm. You know, it was 15 out of 19, that's 20 out of 120 essentially. That's a lot of our patient population, and that's a very high rate of being on a ventilator. So I think you have to be really careful with how, just in the lay, and with lay people, how you ascribe the characteristics of Omicron. It's really nice to sit back and say it's just another cold, except it's not just another cold. Even if the reduction in hospitalizations is what South Africa says, it's still far worse than influenza. It's still really bad, and it may only be a cold, especially if you're vaccinated, and especially if you're vaccinated and boosted. But that's not true if you're an unvaccinated patient, and that's not true if you're in our hospital with Omicron or with Delta, and we're seeing it both ways. And so, Jess, I think this is a dangerous moment for us. I think the numbers are rising. I think you're going to hear that from the CMOs statewide and as well as throughout the metropolitan area. And I think it's going to have a profound impact. It's why you see schools back east where they are about 2 weeks ahead of us. So remember, they are 2 weeks ahead of us, not 2 months as they used to be. They're about 2 weeks ahead of us in this crisis right now. They are closing businesses. They're having to close schools. They're going back to hybrid learning, or they're keeping their mask mandates in place. We have a choice, and it's a hard choice to make, and I know there's not much political willpower out there for this, but I'm telling you, if we don't find the willpower, the virus is going to find us. That's not what we want to see.
I can hear it in your voice, and I think it says a lot that we're getting all these people on one phone call tomorrow.
That's right, and all these CMOs are going to come in and they're going to say the same thing. Our hospitals are at the breaking point, and if you all don't help us, we're in trouble.
We are asking media, though, also to take an active role in tomorrow's conference. So if you're a reporter, journalist, one of our media partner stations, please, we're asking that any reporters that are listening to stream tomorrow's news conference, because what we're hoping will happen is that if you're monitoring your feeds, that you will then ask the questions of your own community. So please stream this tomorrow on all of your outlets and then monitor those questions from your viewers. And then I want you to ask those questions tomorrow during the conference.
And there's lots of communities represented all across Kansas. So trust me, you're going to find someone that looks and thinks like you because of the communities. We have everybody there, from a critical access hospital to a major coronary referral center. So
again, everyone's on board. We want the media to take an active role in this news conference tomorrow. Okay, so before we get deeper into our school conversation today, I do want to find out if there are any reporters on the line.
Hi, it's Cody Holyoke with KMBC9.
Hey, Cody.
Hey, I have some school-related questions, so I don't know if you want to hold off until somebody else wants to talk.
Well, let's just go ahead. It will bring in we're going to bring in Kenny Southwick. He's Executive Director, Cooperating School Districts of Greater Kansas City, and also Dr. Michelle Hubbard. She's Superintendent of Shawnee Mission School District. So we have both of them on the line with us. So good morning, both of you. Thank you for joining us. Cody, go ahead with your question.
Sure. And this is for the doctors and the educators as well. What's the single biggest issue that you think either districts aren't getting, parents aren't getting? What's going on?
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts. Now, subscribe to our morning medical update and open mics with Dr. Stites podcasts.
Cody, you're getting that subscription
now
right there
everywhere
for you right
podcasts are
I think
available.
this is the shortest show we've had.
It's really short today. We really didn't have any questions.
Cody, are you there?
You there?
Hey, yeah.
Go ahead.
Hey, I'm sorry. Just what's the biggest issue in doctors' opinions and in the educators' opinions that schools aren't getting when it comes to Omicron right now? Because we've seen some districts say, we're actually going to hold off on requiring masks. And there's a lot of public pressure to maybe do that. But what's the biggest issue in your mind right now?
Well, I would just say it's COVID fatigue. I'm interested to hear what our school officials are thinking. I think it's just COVID fatigue. It's COVID weariness syndrome, cows. We've said it before. I think it's real. People are tired of it, and they had hopes it was going to end. But the Omicron variant is difficult. There are a lot of kids who aren't vaccinated. There are a lot of still students who aren't vaccinated, or administration and teachers who may not be vaccinated. And the problem is going to be that if you have too many kids out of the classroom, if you have too many teachers who can't teach and not enough administrators who can't run the program, you're going to struggle. And by the way, you're going to hear the same story about hospitals tomorrow. And we're masked and vaccinated. So imagine what happens when you have a population that's not Hawkeye.
And I would say I saw some news articles yesterday on the local news about the school board meetings, and we heard opinions from parents and everything. And I think they're all good opinions in their case. Their opinions against not wanting to wear masks, but those opinions really are not supported by the scientific data, the scientific facts, and the understanding that we know that masks are safe for adults and children. They do not get health consequences from them. But I think the most important thing is, Stephen, we've talked about this, the importance of continuing to be in school, continuing to be in that safe place, have those lunches, have that interaction. We know the virus is spread in other areas outside of the school, but if you can keep the kids in school, keep them from having to be home and quarantining, that is one of the priorities that we need to place on this.
Dr. Hubbard, can you jump in on this conversation?
Absolutely. I appreciate the fatigue of COVID that was mentioned, because I really feel like we heard that loud and clear at our board meeting last night. And in addition to that, I would add the frustration around the idea that hospitals and schools are carrying all the burden, and that there aren't mask mandates anywhere else. Our kids go at night, wherever they want to go, weekends, wherever they're going to go, and are doing that in a large capacity of being unmasked. And so therefore, there's this burden that schools carry, and I think hospitals carry, that we're the only ones fighting the fight. And so we heard that a lot as well. And the idea that we need the community to gather with us to fight this fight, that we can't do it alone.
Kenny, weigh in as well and tell people how you work together with school districts across the metro.
So Dr. Hubbard can speak to, and I'm glad you're here this morning, Dr. Hubbard. It's good to see your face. With the Kansas side, the co-op that I represent is 32 school districts on the Missouri side, kind of regionally as far north as St. Joe. We go out to Knob Noster and down south to Adrian, Archie, and pretty much everything in all the districts in between. So our situation, when we talk about what the issues are, this is a medical show. We're educators, and I agree, the same fatigue in terms of we're carrying the ball. I heard from my administrators yesterday as we begin to try to imagine what's going to happen when we open school up. We fight a little bit of a different issue on the Missouri side. Those of you that have followed Cody and the other reporters recently, Judge Green out of Jefferson City ruled that our health departments can no longer make mandates. They really don't even want to make any recommendations. A lot of our health departments have been hamstrung in the state of Missouri. Add to the top of that, and I'm not going to mention the name of the Attorney General, but has sent cease and desist letters to school districts regarding their mask mandates. The state treasurer's been involved now, keeping districts from not being able to refund their debt unless they come in compliance with the Attorney General. Facing court cases, many of our school districts made decisions to continue to make mask optional or highly recommended under the threat of a lawsuit from the state. And then most recently, our governor a couple of days ago made a decision. I don't know, I don't want to criticize him politically, but it could not have been on the data, but that basically the state emergency around COVID is over, that we've got enough people vaccinated in the state of Missouri now that we really don't have to worry about. So all of those things, I think, have left it up to our local school boards, who, although some people think they can't make that decision, we still believe that they can continue to look at data, work with administration, and make recommendations. Prior to the holiday break, we ran a survey. We had 21 of our 32 school districts that answered, and all but 3 of those basically were moving to highly recommend or recommend or optional. That was before we saw the numbers where they are right now. I can tell you that our people have become pretty talented at pivoting based upon the data and the information. And our conversations right now are, when's that next pivot going to take place? I think it will. I don't want to get in. The last thing, Cody, to answer Cody's question, I think this is what we deal with, I think, is political versus the science versus social media. And, when I hear this morning on one of the local news stations that somebody overseas says that COVID's going to be over in 2 months because everybody's going to get it, they'll have immunity, and in 2 months we'll be out of it. That's confusing, extremely confusing to people. So
it's also just untrue. Let's just be honest, Hawkeye. I mean, and I'm going to have to run and go to clinic, but just to say this concept of immunity, remember that in South Africa, where 70% of people had COVID, they had a major Omicron outbreak. You say, well, okay, but they did okay. Well, they did okay unless you're one of the people who didn't do okay. Yeah. And remember also that population is much younger than the U.S. population. Yep. So I think, we just have to be honest about this with each other and say that this is a difficult moment. And we're not saying don't go to schools. We're not saying don't to close businesses. We're not saying to do that. We're just saying, folks, try and take care of each other. Put a mask on so you can do it. To your point, Missouri's made it more difficult, right? Mm-hmm. I'm a Missouri resident, and I don't agree with what they did, not a bit. Yeah. I don't agree with the Attorney General, I don't agree with the governor, I can say that. But in my space and in my lane in healthcare, if I stay right smack there, what I would say to you is we are going to have one of the most difficult months throughout the entire pandemic. We know how to bend the curve. The tools are right there in front of us, and they're the same simple tools we've had the entire time.
So I have you 3 more minutes. You promised me till 8:20, right?
8:20, there you go.
Well, because I know we're going to be getting a lot of policy questions and science questions, and I need you here to help me navigate that a little bit.
And I would just say, there is a large a priority on not making decisions based on scientific and public health data, but other prioritizations. And what we've seen now is that there are so many places that have closed down. There are so many flights that have been canceled. Things of that nature because of a lack of mitigation. And I think if you use the appropriate, thoughtful public health measures and strategies, you can keep those places open. The community will be healthier. The economy can continue rolling rather than having to shut those places down because either you don't have clients or you don't have staff to work.
You made a great point. You just talked about the airline industry. Look at how bad that's been, right? Look at how many flights are canceled. And then you can say, well, South Africa, let's talk about New York. Let's talk about New Jersey. Let's talk about the US of A here and say what's happening in schools in those districts. And they're running into the same darn problem. If you don't have enough kids there, or if you don't have enough people to teach, or if you don't have enough administrators to run the place, then you're going to be confronted with the same problems we're all going to have. And trust me, you're going to hear from the CMOs tomorrow. This is going to be a tough meeting tomorrow because we're going to tell you about what it's like in the hospitals across the state and across our region, across the metropolitan area. This is a difficult moment, and we're going to talk about having to cancel cases. So, when you see the list of people who we can't do, it's going to be tough, folks, and you got to get this. And you can say, well, I don't believe it, or look, it's just a cold, or whatever other silly thing on social media you want to believe. But tomorrow you're going to encounter the cold hard facts.
And I would also venture to say we mentioned the airlines. They've been really good with mandates about masking and vaccination. I would venture a lot of those people who are infected, and again, they are probably infected but not going to the hospital because they've been vaccinated, probably got it outside of the actual airplane ride itself because of those good mitigation strategies, which are still there, most notably mask use.
As long as they keep their masks on.
If only people took it as seriously as that teacher who sat in the bathroom for 5 hours to protect all those people on the airplane. So what a rock star she was. If only more people were like that. Okay, I know we have a couple more reporter questions on the line. Do you want to scooch?
Yeah, I'm going to run. I got to run.
Okay, you go.
Sorry,
we'll see you tomorrow at 8 o'clock.
I'll be back here at 8 o'clock, and I'll be in a good mood tomorrow.
I hope. Okay, be ready. The questions are coming. All right, so Dr. Hawkinson, I'm going to ask for a couple more reporter questions. So go ahead, please.
Hi, Heather Hollingsworth with the Associated Press. My question is directed at the school officials. I'm assuming you're probably reaching out to staff, trying to get a sense of how many people are going to be out. Talk to me about whether closures are potentially an issue. I've seen some districts having to shut down, buses not able to operate. What kind of things are you looking at as potential issues in the next week or two?
Dr. Hawkinson, I'm sure we'll be talking a lot more about that tomorrow, but any insight that you could share?
I'll just give it to our guests. I think they can probably answer.
Oh, I thought she was
best right
mentioning
now.
hospitals. Sorry. Go ahead.
No.
Okay. You cut out there at the beginning, so go ahead, please.
I'll jump in really quickly. We've actually struggled with staffing all year long. We started the year with about 250 employees short. Most of those are in classified areas, food service, transportation, substitute teachers. And so that's a battle we've been fighting all year, and I don't anticipate that it gets better. We've put in some incentive pay for substitutes, particularly on Mondays and Fridays, because those seem to be our worst days of struggle. And we're looking at increasing paraprofessional pay in the next school year. It's just not something that we can do right at the moment, but we're looking at all of those strategies to try to increase staffing efforts. We did a retention bonus with our CARES dollars, trying to retain employees as much as possible. But it'll be all hands on deck for the next month. I mean, there are times when people at the district office have to roll into schools and roll up their sleeves and support our teachers so that they can support kids in the classroom.
On that note, I want to just show a couple of quick stats kind of to give you an idea of how COVID is affecting metro schools. We're just going to take a look at the two school districts, one on each side of the state line at Kansas City Public Schools. Their COVID dashboard shows 43% of a 2-week positivity rate, 250 cases per every 100,000 people. Then you go over to the Shawnee Mission School District. There was at that point 135 cases. Most of those, of course, students. Most of them are in high school and elementary school. So I want to talk a little bit more. We're going to get to your other question on the line, but I want to talk about last night's school board meeting and decision. But other questions?
Hey, this is Tia from Fox 4. I wanted to chime in on at-home tests quickly. We know there's a big demand in at-home tests right now, and people are supposed to report their status to the health department. Doctors, do you think that's happening? And if not, could that mean we have a higher number of positive COVID-19 cases right now?
I mean, yeah, just personally, I would be highly skeptical that many people are doing that, either calling their primary physician or a county health department. And really throughout the pandemic, it's, kind of in that mid area, I would say April, May of 2020, we really did start to begin and understand that there were probably anywhere from 4 to 10 times the amount of reported cases out there. And I think that's the same thing holds true today, either because people are testing at home and not reporting, but also just because people may have symptoms, know they're exposed, and not test, do the right thing, stay home and isolate for those days. But I think there's a variety of reasons there. But I think we should all assume that there can be anywhere from, just depending what community you're in, we'll say anywhere from maybe 3 to 5 to 6 times more of what the actual cases are. That's just me speculating, but just understanding where we've been throughout this pandemic and understanding that most of the models would suggest that the number of cases certainly are more than the actual confirmed cases.
Other questions on the line?
This is Jared Broyles with 13 News in Topeka. Dr. Hawkinson, we've talked about wearing masks, but that's pretty general. So we're seeing school districts here doing a lot of different things and very different from school to school. Are you recommending masks pre-K through 12 indefinitely for the next 2 months? Just pre-K through middle school? What is the recommendation that you're wanting school districts in Missouri and Kansas to do?
I mean, based on the best medical evidence, and again, one of the seminal papers on mask wearing, because we continue to hear for so long, there's no evidence masks stop SARS-CoV-2. On that large trial in Bangladesh that was done where they looked at whole villages that wore masks versus whole villages that didn't, they saw that mask use did reduce transmission of disease as well. We know also vaccination does help in, number one, protecting you from infection. We know that there are populations that cannot be vaccinated at this point in time. So it's all a combination of those things. And I think we would certainly support the medical and the science data, which all supports mask use, but also vaccination and those other mitigation strategies that are suitable to whatever type of institution you're in, depending on the engineering there in that school or that institution, wherever you're at. As far as social distancing goes, ventilation goes, those all play a role. And if we can do and maximize those things in whatever environment or institution you are in, you will likely be able to keep kids in school, have less going home on quarantine because of exposure in the school itself, but also, as we heard Dr. Stites say, those administrators, those teachers, those counselors, every adult associated with that school as well.
Kenny, can you jump in on that one as well? Just what you're hearing on those younger kids, those younger grades.
Yeah, I think our districts, I think, would reflect what the question we just heard, and what the response was there. It really comes down to we may not be in a situation in Missouri, at least, where we can rely on somebody providing a mask mandate for us anymore. I think the question answered about do we wear them forever or 2 weeks or 2 months? I think that's going to be based on data. I do think that the school districts have tried to look at the most current data and make decisions around that. We don't know what our numbers are going to be. We've been out for 2.5 weeks, and we're going to know over the next week or so what our numbers are going to look like, what our staffing is going to look like, whether we're going to be able to continue to feed kids. And we're going to have to make decisions about that. I really do think that this is, I was talking to Jessica yesterday on the phone, and it's a little bit like I was driving down the highway and I've got a seatbelt on. I wear a seatbelt, not because I think I'm going to be in a crash, but there's a possibility I might be in a crash. Some of us remember back when you didn't have a seatbelt. We ran around with metal dashboards, and it just was not a safer time. We're going to learn to be safer through this. But at this point in time, it comes down to, I think, if somebody's not going to provide the mandate, then take it upon yourself. Be responsible yourself to keep your family safe, to wear a mask, to look at the clusters of people you associate with, to get vaccinated. For gosh sakes, we know that keeps people out of the hospital and from getting real sick. Don't make it a political issue. Make it a family and a personal issue. Make it a school issue in terms of what we do as individuals, not what kind of mandate we're living under. It would be great if we had that coverage. We don't have that coverage in Missouri anymore. So these individual mitigation strategies are going to have to continue until the data gets better. And one thing that alarms me, and we're going to hear it tomorrow, if I wake up tomorrow morning, I've got appendicitis, I'm probably not going to get treated. And at my age, that scares me.
Mm-hmm.
So
that's a harsh reality.
The way I react and the way I do to keep myself safe and my family safe may be different than the people that I live around, but it's not going to change me from doing what I think is right.
Great points, Kenny. Thank you for sharing that. Any other reporter questions on the line? All right, Dr. Hubbard, you are up. The headline this morning, or actually last night, 4-3 voting on the school board for Shawnee Mission School District to make masking optional in schools. Tell folks what that means.
So we were actually already optional at 7-12, and we still have a mandate at pre-K 6. So the board revisited that decision last night to actually extend. We were the written plan actually began yesterday, January 3rd, and the discussion last night was to extend that January 3rd to. And it goes back to Jared's question about 2 weeks, 1 month, whatever the question was, or how long we go. And so it was a 4-3 vote. However, if anyone watched the board meeting, it was originally a 3-4, and then it changed and flip-flopped, and we landed with a 4-3 to leave the plan in place as written, which means 7-12 optional starting today. However, I want to reiterate, this is the part of the plan that people often miss, is that we do have a 3% threshold in buildings. So at any point, a building were to get to 3% of confirmed cases, presumed cases, or quarantine, then we will return to masking in that building for at least 2 weeks or until the data is less than 3%. And that's the piece that people don't talk about that I think is a really important part of our mitigation plan. And it does provide that threshold so that we can keep our schools safe. And if we need to remask, we will. I will tell you, before we left for break, even though we have a mandate in our elementary schools, we were watching elementary data as well. And before break, we would have had 3 schools over that 3% threshold, and they were all elementary schools. So our middle school and high school never hit that 3% threshold. Prior to break, we were just trying to gather some data to see what it was going to look like when we returned. As Dr. Southwick mentioned, we don't know what it's going to be like when they return. Our students return on Wednesday. So our last data update is from December 17th. And it actually, considering 27,000 kids, our data looked actually really good. And we're proud of our mitigation strategies, but we don't know what it's going to look like when they return. But we are fully prepared to return the mask mandate at any point that an individual building is over 3%, and we'll continue our elementary mandate at this point.
Dr. Hubbard, I do not envy you trying to make decisions for thousands of children. I can barely make them for my 2. So hats off to you, your staff, all the school districts out there. I know it's a lot to manage, but take us inside the mind, I guess, of the 4 and the 3. So what were those conversations like? I did hear one board member say something about just how much stress this puts on teachers to have to manage all of that and make sure that people are following the masking guidelines if that were to be the case. We know it's optional, but what kind of conversations, and were there any parents there last night voicing their thoughts and concerns?
Absolutely, there were parents there voicing their concerns, both before the meeting and during the meeting. We actually adjourned the meeting twice because we couldn't conduct the business of the board because of our audience. And so after the second adjournment, we actually had to clear the room, and we just live streamed the meeting with no audience because we couldn't conduct the business of the board, which was disappointing to say the least. The discussion was really all over the board. I appreciate the question. I never try to speak on behalf of individual board members, but I really appreciate our board having the tough conversation in the room. It hasn't been easy on them. They have a lot of pressure, social media, at their homes, phone calls that are extremely inappropriate and difficult for board members. And I want to remind everyone that a board member is no pay. And so I think the toll that is taken on board members has been very difficult this year and last year for that matter. And at the end of the day, all the board members want what's best for kids. They don't necessarily see that the same as Dr. Southwick and I may not actually see everything the same, but at the end of the day, their heart's in it for kids, and I appreciate that. And staff, there were a lot of conversation about what's this mean for our staff members, and unfortunately, similar to our society, our staff is also very divided on this. There are teachers that are like, please, please, please have a mask mandate. And there are other teachers that are like, absolutely not. I need kids to be able to see my face. I need to be able to see kids' face. It helps with the relationships. It definitely helps in teaching phonics. So you hear different, it's very polarized, and it's a very sad time for education in our community. And we just hope for the best and make decisions that are great for kids and trying to keep kids in school. And we feel like our 3% will do that.
Thank you for sharing all that. I know you're under tremendous pressure from all angles. Dr. Hawkinson, you have 2 kids in school. I have 2 kids in school. Just kind of what are your thoughts when you hear that the parents are having we're having to shut down meetings where business is trying to be conducted to keep kids safe in school, and parents can't get their act together?
I think it is important to understand and note that those school board members are there because they want to do that and they believe in that public education and what's going on in that school district. We certainly have seen a reduction in civility for these past 18 months or so, and that is unfortunate. you know, there's just a lot of opinions out there. Probably people who had kids in school for several years and had no issues and didn't have any problems, but now out of the blue they have issues and concerns and feel their voice should be heard. I think they should be heard, but I think it has to be in a civil manner, and we have to continue protocols and systems to get those voices heard. Doing those things that we just heard about is not appropriate, and that doesn't help anybody's situation at all.
I want to bring in the community right now because they're starting to ask questions that I have. So let's just get to them right now because Deb is going to get us started. And on this note, did the vote change because of pressure of parents? I'd like to think that the school board and people running our schools can hold up to the pressure and make the best decision that they know how to make. But how much did the parent pressure play a part in some of these decisions? And Kenny, I'll ask you to jump in on that too. But Dr. Hubbard, get us started.
Yeah, I definitely think the public pressure plays a role. I mean, without question. But I think at the end of the day, I'm not going to speak for those 7 board members to say, yes, the public changed my opinion, or no, the public did not. But I think ultimately they all made the decision that they believe is best for both public schools and for kids. And they all have to go to sleep at night and look in the mirror and make the best decision that they can. They're all elected officials, and I truly believe in my heart that they made the best decision that they could make with their belief system and for their constituents in the areas that they represent.
Kenny, I want to ask you about this because we were kind of visiting about this yesterday, but just I think there's going to be a lot of parents hearing this that just say, well, with Omicron and what we're hearing and the numbers, just put the mask mandate back into schools, just do it. But it's not that easy. So explain why that is the case, because you have policy involved, mandates, governments are putting it in the hands of the school districts to make those individual decisions. You've got Kansas, you've got Missouri. Lay it out for us, why this is not such an easy decision.
Well, it hasn't been easy for the last 20 months, I'll tell you that. And I think it's gotten worse. I think the pressure is there. But I would agree with Michelle. When you run for a school board, there's no money involved in any of that. And you're there to work with the district to provide the best education you can and the safest education you can. But I think, as I mentioned before, we're in a situation where our governments are much different than Kansas and Missouri right now in terms of some of the things that are happening. We're seeing statewide emergency mandates that were gone. I think it has become very political, the decisions that are being made right now. Having said all of that, I feel very confident as we go through the next couple of weeks. We have thresholds in Missouri, our districts. They're not set by health departments, but whether it be 1% in the building or 3%, and that varies on the size of the building. If it's a small building, obviously 3% is a lot smaller number than a high school of 1,500. So we're looking at that. We still believe strongly that our school boards can make decisions to keep their kids safe. But I'll tell you, they do that under threat of a lawsuit with certain individuals, whether it be parents groups or the Attorney General. So all of those are decisions that have to be made. We've got health departments on the Missouri side that have just washed their hands and said, the only thing we're going to do is report positive cases. That's it. They're not going to help with contact tracing, and they're not going to make any mandates and really not even make recommendations. So all of that makes it very difficult for decisions to be made. But we've kept kids safe to this point, as safe as we possibly can in the midst of a pandemic by trying to make good decisions based upon today's data. And sometimes what we thought in the morning is different than what it is in the afternoon and the evening, and we're making adjustments. And I think that's where we're going to continue to be. If these numbers explode and we can't have school because of staff, and we can't hire subs, and we can't feed kids, and it's going to force us to make decisions. If the numbers go back down, great. I did hear the last thing I'll say related to this, that again, my comment about it's going away in 2 months. I was listening recently to a show, it was a national show that said we need to bone up on our Greek alphabet because the variants are going to keep coming and they're going to have Greek names. So it is very confusing. It's difficult for our boards, but I would pat them on the back for the decisions that they've made and that they'll continue to make to keep kids safe and keep them in school.
All day long, for sure. Okay, let's talk about testing. Dr. Hubbard, a question is, I guess in a district in California, they were having all kids test before they came back from the break. Would that be a good mitigation strategy? Is that possible? Where are we with testing? What do those recommendations look like?
Well, I would have to ask a medical expert about whether it's a good idea. I have to believe it's probably a good idea. I mean, obviously, if you had a negative test, it would be amazing for everybody. But
is it realistic?
It's not realistic. It wouldn't even be possible for us, quite frankly. We are testing anywhere from, it ranges depending on where the rate is. I anticipate what we will be testing tomorrow will be one of our highest days, and probably Wednesday, Thursday, and Friday. I anticipate those will be really high. We have been we started testing as a school district really early in the pandemic, and our neighbors have joined us in that. And so our families have been able to get a test if they're symptomatic here in the school district for over a year now, I believe. And so that's a great resource for our families. But again, it's for symptomatic. We are implementing test to stay starting this week as well. So if you have been exposed, rather than being in quarantine, you can test to stay in school. So we're hoping that that helps not only with students, but with staff that have been exposed as well. And then we believe the Johnson County Health Department will be giving us new guidance in the next week, moving quarantine from 10 to 5. So we're hoping that that also will help keep students and staff in school. But yeah, testing everyone would be great. It's just not realistic for us or anybody, I think, for that matter, on the availability of testing and the turnaround of testing time.
Yeah, I think that's the global problem. The large umbrella that's covering all this is the accessibility of tests and the turnaround time. Certainly, home tests would be useful in certain instances, but we know those are difficult to get a hold of as well.
A couple more school-related questions, and then we're going to wrap things up. A question about contact tracing. Marta is asking, how are schools managing contact tracing, or are they?
Up to this point, I feel like we've done a fairly good job with that. It's been a little more difficult in the last couple of months, just from a staffing standpoint. However, we were told by the county this week, and we actually are in complete agreement with them, is that we're not going to be focusing on contact tracing because, quite frankly, with the number of cases, we can't keep up. So we're going to do our best. We're going to do our absolute best. But right now, we're saying it goes back to those layers of mitigation, and number one, being vaccinated and boosted when possible is the number one defense. And then masking, it is mask optional, but that doesn't mean everybody has to take a mask off. And I'm hopeful that they don't. I'm hopeful people that want to wear a mask absolutely can do so. The county told us yesterday, last night at our board meeting, that they're encouraging KN95 mask, which we do provide for students and staff if they would like that, or to use a surgical mask with a cloth mask and double mask. So there are those strategies for families as well.
Are students masking? Are those older kids masking? Are they good at that, or is it kind of a mixed bag?
It's a mixed bag for sure.
Question about teachers. If a teacher gets COVID from work, Joanne wants to know if they have to be out on quarantine, do they have to use their own sick leave? Does the district cover that? Or are you kind of on your own if you get sick?
So last year there was some provided monies due to a federal mandate, but no, this year they are using their own sick days.
All right, we are going to wrap this up. Great questions today from our community. We will try to get to some of those tomorrow for our CMO meeting. So I want to go around real quick and get some final thoughts. Kenny, I'm going to start with you. Just final thoughts. What do you want folks to know, parents to know, students to know as we head back to school after break?
Well, I can't listen to Dr. Stites and not think that things are going to change over the next couple of weeks. I think we have to be vigilant. I think let's not, and Dr. Hubbard just mentioned it, let's not forget about the importance of vaccinations. We know very clearly that the people that are getting very, very sick are those that are unvaccinated, and many of those that are passing on are unvaccinated. So Let's continue to get people vaccinated. I would just say this, as a parent, speak to your physician about vaccination, make a decision. Look around, wear a mask. If you're in a mall in Missouri or northern Missouri or in Kansas, or you're in a restaurant and the majority of the people aren't wearing a mask, don't be afraid to wear your mask if that makes you feel comfortable. Don't forget to wash your hands and do all the mitigation things that we've been involved in that have kept kids safe and have kept our family safe. We can't drop that right now. We need to kind of supercharge that to get through this. And then just wait and see what happens over the next couple of weeks in terms of decisions are going to be made locally. And as Dr. Hawkeye said, let's be civil about the decisions that are being made. Please be civil.
Dr. Kenny Southwood, thank you so much for being with us today. We appreciate it. And speaking of civil, Dr. Hubbard, I can't quite get past in my head that you had to shut down a meeting last night and go and to go viral because parents couldn't get themselves together and have a civil conversation about how to get our kids in school safely. So that's tough. I would ask you, just maybe go through with us, just kind of what's in your crystal ball as kids head back to school for the rest of this year, and what's your message to parents?
So, I don't want to reiterate or just to again say what Kenny said, but Dr. Southwick hit the nail on the head in regards to, civility, layering mitigation strategies. By all means, vaccinate and boost when possible. So those things are so very important. My crystal ball is to absolutely be able to keep kids in school and really start to focus back on student achievement. I think there's been so many social emotional issues with families and teachers and just in schools, and I'm hopeful that we can find a settling place for kids and adults through the pandemic and really start to focus back on things that are important, especially student achievement and academics, and making sure kids feel safe in school and safe in the community. I would agree with Kenny that if you're somewhere where you're not comfortable, by all means wear a mask and don't let the bullies win this battle. I really am hopeful that in our schools, with masks being optional, that people can be civil, kids can be civil and respect opinions of others. And if you want to wear a mask, you wear a mask. And if you don't want to wear a mask, then you don't wear a mask. But at the end of the day, everybody has a personal choice in this, with the mask optional at our secondary schools. And I just hope that we can be civil in that. But at the end of the day, keeping our schools open is the number one priority for us.
Absolutely. Making masking cool again. Thank you so much for what both of you do. We know it's not an easy job. So thank you for coming on and sharing your message, Dr. Southwick. Dr. Hubbard, have a great day. And Dr. Hawkinson, final thoughts from you today.
Yeah, I mean, I don't know that there's much left to do than echo those thoughts of our guests. I agree 100%. And we know, now with such widespread disease, we know with lack of restrictions and gathering and masking and all of those types of things, the best thing that you can do as an individual and to protect your individual bubble and family is to go get vaccinated. If you are meet that criteria for getting that additional dose or that booster dose, please go get that. We know that provides protection even against Omicron. We know overall the vaccines continue to provide protection against hospitalization, severe disease, and death. And vaccination continues to be the way that we are going to be able to keep people healthy and out of the hospital. So please, if you haven't gotten vaccinated, please go get vaccinated. If you do for a booster, please go get those boosters.
Thanks, Doc Hawk, and thank you all for being with us today. And do not forget, you can catch our shows anytime by logging on to our Facebook page or go to our YouTube channel. Again, we want to tell you about our special event taking place tomorrow right here at 8 o'clock. It is the first statewide CMO Media Community News Conference that will be held to share crisis communication on the impact of the current COVID surge. Delta is still circulating in our communities, resulting in many critically ill people. Omicron is coming on strong, and we are treating many seasonal respiratory diseases, including flu. Access to health care for everyone is being affected right now, but you have the power to help. So please bring your questions and learn the steps that you can take to help yourself, your neighbors, and our healthcare system. So you can watch, you can participate on Facebook and YouTube. You can use the handle KU Hospital. You can listen to your local media for updates. And we are asking media, please take an active role in tomorrow's meeting. We are asking you to monitor your feeds and ask questions of your viewers so that we can get all of those questions answered tomorrow. So thank you. Please join us right here at 8 a.m. tomorrow, and have a great day.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.